validity, repeatability. Acceptability, validity, repeatability. False answer, affordability, feasibility. Criteria of screening. Answer, acceptability, repeatability, validity. Criteria of a screening test. Answer, acceptability, repeatability, validity or accuracy. Healthy carrier occurs in. True answer, salmonellosis, cholera. False answer, pertussis, measles, influenza. Healthy carrier details: polio, cholera, meningococcal meningitis, salmonellosis, diphtheria. Polio, cholera, meningococcal meningitis, salmonellosis, diphtheria. Healthy carrier: polio, cholera, meningococcal meningitis, salmonellosis, diphtheria. In EPI program, following vaccines are included. True answer, BCG, tetanus, hepatitis B virus, meningococcus. False answer, cholera. Carrier state implies. True answer, presence of disease agent in the body serves as a potential source of infection, epidemiologically more dangerous than cases. False answer, presents with recognizable clinical feature, more infectious than cases. Criteria or elements of carrier stage: the presence in the body of the disease agent, the absence of recognizable symptoms and signs of disease, the sharing of the disease agent in the discharges or excretions, thus acting as a source of infection for other persons. Method which kill spores are. True answer, hot air oven, autoclave. False answer, pasteurization, tyndalization, boiling. Spores can be killed by ethylene oxide, formaldehyde, glutaraldehyde, hydrogen peroxide, peracetic acid, ophthalmic acid, plasma sterilization, autoclave, hot air oven. Factors for primary immune response are. True answer, dose of antigen, route of administration, adjuvant. False answer, time of administration, type of vaccine. Factors for primary immune response: dose of antigen, nature of antigen, route of administration, adjuvant, nutritional status of the host. Basic approaches in epidemiology are. True answer, asking question, making comparison. False answer, proportion, outbreak investigation, surveillance. Attributes of endemic diseases are. True answer, constant presence of disease in a population, constant presence of disease in a defined geographic territory. False answer, excess of normal expectancy, affects multiple countries, scattered presence of disease in a geography. Endemic, it refers to constant presence of disease or infectious agent within a given geographic area or population group without importation from outside. May also refer to the usual or expected frequency of the disease within such area or population group. Susceptibility of host is influenced by. True answer, genetic predisposition, pathological condition in the immune system. False answer, good housing, lifestyle, genetic counseling. Susceptibility of the host is influenced by the level of community, genetic makeup, level of exposure, state of health, overall fitness of the host. Killed vaccines are. True answer, plague vaccine, anti-rabies vaccine, hepatitis B vaccine. False answer, oral polio vaccine, measles vaccine. List of live attenuated vaccine: measles, rubella, adenovirus, mumps, salmonella, influenza, rotavirus, smallpox, chickenpox, oral polio, sabin, yellow fever, TB, oral Vibrio cholera. Kill vaccine hepatitis A B, H influenza B, meningococcal A B, Japanese encephalitis, rabies, cholera, plaque, Yersinia pestis, rickettsia, streptococcus pneumoniae, N meningitis, salmonella, bacillus anthracis, pertussis. Healthy carriers may be found in true answer cholera, enteric fever, false answer hepatitis B, whooping cough, measles. Cause identification of disease is important for true answer detection of epidemic, estimation of disease burden, prevention and control of disease, diagnosis of disease, treatment of disease. The subclinical period of disease means true answer time of diagnosis since exposure, period prior to onset of symptoms, period after exposure to the agent, before time of diagnosis. False answer onset of symptoms. Chain of infection is composed of true answer reservoir, mode of transmission, false answer incubation period, infectivity, herd immunity. Reservoir may be of three types: human reservoir, animal reservoir, reservoir in non-living things. Chain of infection, source of infection, modes of transmission, susceptible host. Examples of positive externality in healthcare are true answer herd immunity, user fee. False answer gardening, climate change, radiation exposure. Herd immunity is applicable for true answer poliomyelitis, measles. False answer tetanus, rabies, hepatitis B virus infection. Herd immunity or community immunity, oral polio or Sabin vaccine, measles, diphtheria. Relationship between prevalence and incidence. True answer prevalence depends upon incidence and duration of illness. The longer the duration of disease, the greater its prevalence. Incidence rate is more ideal than prevalence rate for studying disease etiology. False answer expressed as incidence divided by mean duration. Decrease in prevalence happens only from a decrease in incidence. Screening. True answer is used to control of disease. Test can be evaluated by sensitivity. Test must satisfy the criteria of acceptability. False answer is not used for case detection. Test cannot be evaluated by specificity. Screening. True answer is used to control of disease. Test can be evaluated by sensitivity. Test must satisfy the criteria of acceptability. False answer is not used for case detection. Test cannot be evaluated by specificity. Screening test: pap smear for cervical cancer, serological blood test for syphilis, chest x-ray for tuberculosis, test for blood pressure, blood sugar, blood cholesterol. Types of screening: mass screening, high risk or selective screening, multiphagic screening. Multiphagic example: lung function assessment, diabetes, cancer of the breast. Screening test: acceptability, repeatability, validity or accuracy. The characteristics of innate immunity are true answer that exists prior to exposure to the antigen. It includes host defenses. Example: skin and mucous membrane. It is non-specific. False answer: it improves after exposure to organism. It has long memory. Cell-mediated immunity involves the followings. True answer T lymphocytes, macrophages. False answer IgG, eosinophil, complement. Humoral immunity আর হচ্ছে সেল মিডিয়েটেড ইমিউনিটি। হিউমোরাল ইমিউনিটি innate, complement and neutrophil, macrophages and natural killer cell, adaptive B cell and antibodies made by plasma cell, helper T cell and cytotoxic T cell. Cell mediated immunity constituent, macrophage, T lymphocyte, natural killer cell, cytotoxic T cell. The immunoglobulins transmitted from mother to fetus are: true answer IgG, IgA, false answer IgM, IgD, IgE. Humoral immunity, cell mediated immunity, innate, complement, neutrophil, cell mediated macrophage, natural killer cell. Acquired humoral immunity, the B cell, আর হচ্ছে সেল মিডিয়েটেড ইমিউনিটি হেল্পার টি সেল, সাইটোটক্সিক টি সেল. Herd immunity does not protect the individual from: true answer rubella, pneumonia, smallpox, chickenpox, false answer measles. The CD4 cells are: true answer monocyte, T helper cell, macrophages, false answer C, cytotoxic cell, eosinophil. CD4 cells are mainly হচ্ছে হেল্পার টি সেল, এছাড়া মোনোসাইট, ম্যাক্রোফেজ, tools of measurement in epidemiology: rate, ratio, proportion, false answer incidence, prevalence. Basic tools of measurement in epidemiology: rates, ratio, proportion. Morbidity rates are: true answer incidence rate, prevalence rate, false answer case fatality rate, attack rate, fertility rate. Morbidity indicator: incidence and prevalence rate, notification rate, attendance rate at outpatient department, health center, admission, readmission and discharge rate, duration of stay in the hospital, spell of sickness or absence from work or school. Incidence and prevalence rate, notification rate, attendance rate at our patient department, health center, admission, readmission and discharge rate, duration of stay in the hospital, spell of sickness or absence from work or school. Endemic means that a disease, false answer occurs clearly in excess of normal expectancy, affects a large number of countries simultaneously, exhibits a seasonal pattern. True answer is habitually present in human population, usual occurrence of a disease. True answer is habitually present in human population, usual occurrence of a disease. Prevalence rate is increased by: true answer longer duration of the disease, increase in new cases. False answer prolongation of life of patient without cure, shorter duration of disease, high case fatality from disease. Healthy carriers occur in: true answer salmonellosis, cholera, false answer pertussis, measles, influenza. A carrier is an individual who harbors the organism but is not infected, as measured by serological studies. False answer affects, produces, poses affected, achieves disease, gained infected. Carrier: a carrier is defined as an infected person or animal that harbors a specific infectious agent in the absence of discernible clinical disease and serves as a potential source of infection for others. Prevalence rate measures: true answer both old and new cases, only the susceptible person, both point and period prevalence. False answer only the new cases, only the old cases. Prevalence types: point prevalence, period prevalence. The measurement of morbidity are: true answer incidence rate, prevalence rate, false answer case fatality rate, survival rate, standardized rate. Components of epidemiology are disease frequency, disease distribution, disease determinants. False answer: environmental sanitation, health promotion. Components of epidemiology are: true answer disease frequency, distribution, determinants. False answer environmental sanitation, health promotion. Incubatory carriers include: true answer measles, influenza, hepatitis. False answer tuberculosis, cholera. Gaps in natural history of chronic diseases are: true answer indefinite onset, long incubation period, absence of known agent, multifactorial causation. False answer short latent period. Basic epidemiological tools are: true answer rate, proportion, ratio. False answer percentile variance. Examples of tertiary prevention are true answer early physiotherapy to an affected limb, laser therapy to prevent blindness in diabetes mellitus. False answer vaccination against rabies, early treatment, environmental sanitation. Components of epidemiology are: disease frequency, distribution, determinants. False answer demography, hospital management. Disease frequency measurements are: true answer incidence rate, prevalence rate. False answer fertility rate, attack rate, case fatality rate. Active immunity can be acquired by the followings: inoculation with live or killed vaccine, inoculation with toxoid, exposure to infectious agent. False answer inoculation with immune serum, colostrum feeding. Active immunity can be acquired by the followings: true answer inoculation with live or killed vaccine, inoculation with toxoid, exposure to infectious agent. False answer inoculation with immune serum, colostrum feeding. Active immunity natural, exposure to the infectious agent, subclinical infection, example chicken pox. Artificial vaccine, toxoid. Passive immunity natural, maternal antibody IgG, cause placenta to baby, IgA through colostrum. Artificial AB from other source, human immunoglobulins. Sample registration system. True answer denotes dual record system, covers parts of the country, includes segments of population, enumerates birth and death, continuously conducts independent survey every 6 months. Commonly used epidemiological indices for tuberculosis are: true answer prevalence of infection, incidence of disease, BCG vaccination coverage, DOTS coverage. False answer annual infection rate. Basic epidemiological tools are: rate, proportion, ratio. False answer mean, median. For herd immunity to exist, following condition must be met: true answer transmission must be direct from one member of host species to another, reservoir in which the organism can exist outside the human host. False answer the disease agent must be restricted to a single host species. Infections induce partial immunity. Population approaches a non-random mixing. Achievement of herd immunity: natural process, artificial process. Natural process following attack of the disease, following the apparent or subclinical infection. Artificial process immunization. Elements contribute to herd immunity: occurrence of clinical and subclinical infection in the herd, immunization of the herd structure. Elimination refers to: true answer decreased incidence of disease, reducing financial burden to the community, interruption of transmission of disease, presence of the infectious agent in the environment. False answer reducing complications of disease. Active immunity of an individual develops, true answer, as a result of infection by a specific vaccination, immunity specific for a particular disease. False answer by administering antibody containing preparation by vertical transmission across the placenta. Epidemic prone diseases: true answer diabetes, hypertension, cholera. False answer kidney disease, yellow fever. Epidemic means the usual occurrence in a community or region of disease. Epidemic means the unusual occurrence in a community or region of disease is a specific health related behavior or health related event clearly in excess of expected occurrence. Epidemic borne diseases. True answer diabetes, hypertension, cholera. False answer kidney disease, yellow fever. Components of epidemiology are as follows: disease frequency, distribution, determinant. False answer health promotion, environmental sanitation. Um, Endemic means when a disease. True answer occurs clearly in excess of normal expectancy. He is habitually present in human population and usual occurrence of a disease. False answer affects a large number of countries simultaneously, exhibits a seasonal pattern. Incidence of a disease. True answer includes new cases only in numerator, needs time specification, can be applied only for endemic disease. False answer includes old cases only in numerator, includes both old and new cases in numerator. Numerator, number of time an event has occurred in a population during a given time period. Denominator, the population to which the events are related. Biological properties of disease agent are: true answer infectivity, pathogenicity, virulence. False answer toxicity, autoresis. Passive immunization is useful in the following infections. Agent characteristics. It can be both living and non-living. Biological agent exhibit certain properties: infectivity, pathogenicity, virulence, absence or insufficiency or excess of a factor, chemical factor, nutritional factor, necessary to factors necessary to health. Route of entry, incubation period, generation time, case or carrier. Agent characteristics, it can be both living or non-living. Infectivity, pathogenicity, virulence, absence or insufficiency or excess of a factor, route of entry, incubation period, generation time, case or carrier. Passive immunization is useful in the following infections. True answer hepatitis B, rabies. False answer hepatitis E, typhoid fever, tuberculosis. Prevalence increases if, incidence increases, recovery decreases. False answer case fatality increases, diagnostic facilities improve, shorter duration of disease. Features of chronic diseases include: true answer long latent period, prevention demands mixed intervention. False answer duration more than 2 months, definite onset, agents are known. Features of chronic diseases include: true answer long latent period, prevention demands mixed interventions. False answer duration more than 2 months, definite onset, agents are known. The growth rate of a country's population depends on: true answer birth rate, death rate. False answer climate, socio-economic factors, a boon to the commodities market. In calculating prevalence of a disease, true answer needs time specification. Numerator includes both old and new cases. False answer numerator includes new cases only, numerator includes old cases only, denominator is the total population. Descriptive epidemiology deals with the distribution of disease, occurrence of a disease. False answer application of preventive measures, identification of risk factors, frequency of disease.